Do you go number 2 once a day or 3 times a day? Or maybe you only go 4 times a week. Have you ever wondered whether your poop experience is normal? In this episode, we'll discuss all the ins and outs of going number 2, such as how often it's recommended, what it should look like, and what to do when it's not normal. We'll even share a scientific scale for evaluating your stools. Yes, really. I'm Professor Megan.
I'm Professor Susan, and we're
your nutrition profs. We are registered dietitians and college professors who have taught more than 10,000 students about health and nutrition. We have answered a lot of questions about nutrition over the years.
Some questions we get asked every year, and some are rarely asked, but very interesting.
We are here to share our answers to these common and uncommon nutrition questions with you.
So bring your curiosity and let's get started. Welcome to our class. Hi, everyone. Welcome to episode number 2, and it's all about number 2, if you know what I mean.
Yes, that's right. Today we're talking about poop. Before we get started, there's a lot of different terms that get used when discussing poop. Sciencey words like defecation or having a bowel movement refers to the act of pooping. Feces, fecal matter, or stool can be used when referring to actual poop. And the large intestine is sometimes called the colon or large bowel. So we'll be using a lot of those words in today's episode. So the question we're going to answer: how many times a day should I poop? I always tell my students this is a great question. This may not be one of the most commonly asked questions, and I think that's mostly out of embarrassment. It's something that's typically considered an impolite topic in social settings and maybe not discussed as openly. I don't know, Susan, what do you think? Do you get this question a lot?
I don't. I think you're right. I think students are just embarrassed. It's definitely one that it would be an after-class discussion instead of an in-class raise your hand, hey.
Yes, definitely. I think I've been asked this privately after class. We study digestion as part of our class curriculum, and elimination is a function of digestion, making this the perfect place to talk about all things poop.
One thing about talking about poop is that if you're a registered dietitian like we are, you have to be okay with talking about stuff like this because you're talking with patients about it, you're talking with colleagues about it. So it is something that we probably talk about more than a lot of other professions.
I definitely agree. And I know I've been in mixed company and we'll be eating and something will come up and I have no problem. And other times people are like, could we talk about something else?
Well, everybody poops.
Everybody poops.
So we're going to talk about this topic today.
All right. So if everybody poops, why? What is the function of pooping?
Well, there actually is a scientific definition.
Let's hear it.
The scientific definition is to eliminate waste products that result from digesting our food. You know, we all kind of know why we have to. Whatever's left over that doesn't get digested has to come out. Digestion is the physical and chemical breakdown of food. And when we eat, we start the process of physically breaking down food in the mouth. So we chew it and we mix it together with our tongue and our teeth and the roof of our mouth. And then we soften it when we mix our food with saliva. And then we swallow. And once we swallow it, it goes through a muscular tube called the esophagus. And then it dumps into the stomach. And here in the stomach, the food continues to mix and churn and squish and it mixes with juices in the stomach before it goes on to the next organ called the small intestine. And your small intestine is what I like to call the party place of digestion.
I like that.
Everybody shows up there at some time or another. And your small intestine is actually, the name small is a little bit of a misnomer because the small intestine can be anywhere from 10 to 20 feet long.
For comparison, for you listeners out there, a regulation basketball hoop is 10 feet high.
Holy cow.
Yeah, so potentially 2 of those.
Right. So think about that all squished up on the inside of your abdomen. It's quite amazing, actually. So in the small intestine, that's where 90% or more of your food is absorbed. And once it's absorbed, it gets used by the body for all kinds of different things. But anything that doesn't get absorbed, things such as fiber, it'll eventually get pushed on to the next organ, which is called the large intestine or the colon.
So the colon is about 5 feet long, so significantly shorter than the small intestine, and this is where we absorb most of our water. It's home to billions of living bacteria that we call our gut microbiome, but these are friendly bacteria that live in our colon and feed on our undigested fibers. They have so many amazing functions that we are just now starting to learn about. They contribute to your metabolism, your immune system. They produce nutrients such as vitamin K, the B vitamin biotin, short-chain fatty acids. They even produce feel-good neurotransmitters such as serotonin and dopamine. It's so amazing. We're going to do a full episode on the gut microbiome.
I know. I'm really excited about that.
Me too.
And one thing you listeners may not know is when we talk about the small and large in terms of the intestines, we're actually talking about the diameter and not the length.
Correct.
Unabsorbed food will eventually become your feces or poop. And if poop moves through the colon too quickly for whatever reason, there's not enough time for water to be absorbed, and the result is more liquid stools or diarrhea. And of course, the opposite is true. If fecal matter moves too slowly through the colon, more water gets absorbed, and then people may struggle with passing harder stools or constipation. So the amount of time it takes for feces to move through the colon is called intestinal transit rate. Fancy word, intestinal transit rate. Something I'm sure you've always wanted to know. With so many bacteria living in the colon, it's thought that up to 1/3 of your poop is made up of these bacteria. Another third is the remaining fiber that came from your diet that didn't get digested and absorbed in the small intestine. And the rest of your poop is other waste products such as remnants of undigested medications. It could be food colorings. It could be cholesterol that hasn't been absorbed in the small intestine. So your poop is about a third. A third bacteria, a third fiber, and the third a category we'll call other.
So as Susan just explained, the consistency of our stools is related to how much water is or is not absorbed in the colon in the final stages of the digestive process. In general, if you're producing soft, well-formed logs that aren't difficult to push out, you're probably in good shape. However, poop does come in a wide variety of consistencies beyond well-formed logs, which can make it difficult to determine if you're having quote-unquote normal bowel movements or not. Various scales have been created to identify stool types, but the most widely used is the Bristol Stool Form Scale.
Yep, folks, there's a scale for that. So in the late 1980s, researchers in the Departments of Medicine and Radiology at the Bristol Royal Infirmary created a rating system for poop based on the cohesion and surface tracking of the stools ranging from a score of 1 to 7. They called this the Bristol Stool Form Scale, and we have a scale in our show notes.
Please go check it out, because the original scale was created solely with written descriptions of each type, which is great for podcasting, and I'm about to share with you. However, drawn images have since been added, and they're great. So let's break it down. Type 1 represents the hardest stool. It's described as separate, hard lumps, like nuts that are hard to pass. Type 2 is sausage-shaped but very lumpy. These first two types, in conjunction with other symptoms, are typically representative of constipation.
Type 3 is also described as being like a sausage or snake, but with cracks on its surface. And type 4 is the same, but instead of having cracks, it's smooth and soft. Type 5 are soft blobs with clear-cut edges. So if you want to know what a normal or common or ideal type of poop is, you'd want to be on the Bristol scale between 3 and 5.
Type 6 are called fluffy pieces with ragged edges, and these are mostly considered mush. Type 7 is basically water, it lacks any solid pieces, and these final two types, in conjunction with other symptoms, are typically considered diarrhea.
So why in the world would anybody want to categorize our poop? Well, the original purpose of the scale was to help doctors treat patients with IBS, or irritable bowel syndrome. And they wanted to help these patients identify intestinal transit rate. Treatment approaches like whether to follow a high or low fiber diet would differ for those with slow versus fast transit time.
One of the first studies using this scale recruited 30 adults with IBS. So participants were given the scale and asked to describe the type of stool, their urgency to have a bowel movement, and feeling of completing their bowel movement. So intestinal transit time ranged from 6 to 108 hours. Ooh. But most patients pooped 0 to 3 times a day.
Okay, 108 hours? Holy cow.
That's a long time to go without.
Yeah, well, how many days is that?
4.5.
Oh my gosh. Poor things.
So researchers did find an association between looser stools and frequency of movements.
That makes total sense, right? If you're having more frequent bowel movements, then the fecal matter is going to be moving more quickly through your colon, and then there's not as much time for water to be reabsorbed.
So the Bristol scale has since been used and validated in several different populations, and it's really helpful in diagnosing things like IBS and also in evaluating the effectiveness of those treatments, like Susan said, not just with IBS, but other bowel conditions as well.
What we're aiming for is soft but formed logs. But let's get back to the original question. How often should we be having them, and what is the recommended poop frequency?
Well, when all goes according to plan, it's thought that pooping between 3 times a week to 3 times a day is fine.
Wait, really?
Yeah. Yeah. So in my research reviewing several years of bowel function studies that included a wide group of ages, ethnicities, geographic locations, all authors seem to identify the norm for comparative purposes as defecating between 3 times a week and 3 times a day. And the first studies to report this were all the way back in the 1940s.
That's a huge difference, right? 3 bowel movements a week versus more than 20 a week.
I know, right? A lot of variability for one to be quote unquote normal. A group of researchers in East Bristol, remember?
Oh my gosh.
This is where the Bristol scale originated.
They do love to think about poop in Bristol.
They're experts. They surveyed nearly 1,900 adults and found that defecation intervals were typically around 22 to 27 hours. So basically 1 bowel movement a day.
Most people reported early morning as peak bowel movement time, so between like 7 and 8 a.m. And although there was another common peak time around 6 p.m., it was thought by the authors to be after the participants' main meal of the day. I think it's because people don't want to poop at work.
I think you're right.
So they want to poop before or after work, and you want to poop in your own home, not in public. Very, very few of the participants reporting having any bowel movements at night. So using the Bristol scale, there was a lot of variation, but fortunately, type number 4, smooth and snake-like, was most common in both sexes. In general, the women more commonly reported lumpier stools, so like type 1 and 2, and mushier stools, type 6, were more commonly reported by men in this particular study. Similar studies seem to echo that the average number of bowel movements per week is about 7 to 8, so once a day, and women tend to report constipation more than men.
A study of over 20,000 adults looked at lifestyle factors and bowel movement frequency, and they found that women on average had fewer bowel movements and were also less likely to have daily bowel movements. They also found that vegetarians, especially vegans, had a higher frequency of bowel movements than those who ate meat.
That makes a lot of sense, right? Because they're going to be consuming a lot more fiber.
Absolutely, and because we don't absorb fiber, it moves everything through. They also found women who exercise regularly also reported more frequent bowel movements, but men reported higher bowel movement frequency with greater alcohol intake.
I wonder what that means.
Another survey out of Japan found that women reported constipation more than men, so just like the other study. They also found that constipation issues increased with age. So only 20% of respondents in their 20s reported constipation, but this number increased to nearly half of all participants in their 70s. And then finally, they found that bowel movements changed with menstrual cycles. So more than 40% of participants reported experiencing more diarrhea while menstruating, and about 18% reported more constipation.
So it sounds like type of diet, exercise, alcohol intake, age, and menstruation are all factors that might affect bowel movement frequency.
That's a lot.
Yeah, pooping's complicated.
Who would have thought? So let's talk about bowel frequency dysfunction. So remember, Bristol scale types 1 and 2 are typically representative of constipation. But what actually is constipation?
Well, there is a definition, a clinical definition of constipation. According to the National Institute of Diabetes and Digestive and Kidney Disorders, also known as NIDDK, the clinical definition of constipation is having fewer than 3 bowel movements a week and having stools that are hard, dry, lumpy, and difficult or painful to pass. So, as we've said before, Bristol types 1 and 2. Also, with constipation, you may have a feeling that not all the stool has passed when you go.
So, what causes this to happen?
Some diseases and conditions like untreated celiac disease and IBS can cause constipation. Some medications and supplements like calcium and iron can cause constipation. Not consuming enough fiber or enough water, and a lack of regular physical activity also seems to contribute.
So that being said, the short-term treatments for constipation include eating more fiber, drinking more water, and being more physically active.
Yeah, those are generally things the doctor would recommend, I think.
Absolutely. And taking over-the-counter medications such as stool softeners and laxatives can also help with this, but you want to be careful as people can become dependent on those things. And then for those with chronic constipation, there are prescription medications that can be used, such as things that will stimulate your digestive tract to kind of get things going. Natural remedies like drinking prune juice may also help. Prunes are dried plums that naturally contain a significant amount of sorbitol that is thought to contribute to its laxative effects. Sorbitol is a type of sugar alcohol that occurs naturally in some fruits, but it's also commercially processed and used in many sugar-free or low-sugar foods because it provides all the sweetness without the calories. Sorbitol and other sugar alcohols like xylitol and mannitol are not fully broken down in our system, and in addition to its laxative effects, can also cause uncomfortable bloating and gas.
Yeah, so if it's not broken down, it's going to become part of the feces. When sugar-free candies first came out, I had an experience with that.
Oh, tell us.
This was early in sugar-free candies, so probably 20 or maybe 25 years ago. And I ate several pieces of the sugar-free hard candy, and I experienced the laxative effect after that.
Oh, no.
But you can find sorbitol in lots of things besides sugar-free candy.
Oh, yeah. It's in like those high-protein ice creams. Sometimes I've seen it in like sugar-free cough drops.
Oh, yeah. Just be careful. Moderation.
Everything in moderation.
Prunes also contain something called chlorogenic acid. This is the same ingredient that you can find in both regular and decaf coffee that can get your bowels moving, especially in the morning. Lots of people who drink coffee in the mornings report that they have to go not long after they finish their first cup. At first, researchers thought it was the caffeine, but we don't see the same response after drinking a soda or an energy drink, so probably not caffeine. More recent evidence has identified this chlorogenic acid, and scientists think that it induces the release of a hormone called gastrin that's released from the stomach walls. Gastrin causes the stomach to contract more forcefully. It relaxes the sphincters between the gastrointestinal organs so that it moves food through more quickly. And it sends a message to the colon to make room because more food is coming.
Yeah, clear out. More is coming.
Pooping is complicated. One other thing you can do if you are constipated is more mechanical than chemical, and that is to use a stool under your feet to get your pelvis into a more suitable position. A small study found that the use of a defecation postural modification device.
Wow,
say that 10 times fast.
That's fancy.
Defecation postural modification device significantly increased reports of bowel emptiness and reduced straining.
So I actually have a squatty potty. We're not sponsored, although we're open to it. I really like the squatty potty. It kind of lifts your feet up a little bit and just like you said, it just kind of puts your body in a more natural position.
I know a lot of people who swear by it.
Well, I'm one.
So we have constipation at one end of the defecation spectrum. What about the other end? What if someone's having too frequent bowel movements?
Diarrhea is defined as having loose, watery stools 3 or more times a day. It can occur acutely, like for just 1 to 2 days, persistently, so more than 2 weeks but less than a month, or people can suffer with chronic diarrhea, so more than a month but not necessarily constant.
It's awful.
That is awful. Common causes of diarrhea include bacterial or viral infections, things like food poisoning, parasites, even some medications. I know antibiotics in particular tend to cause some people to have diarrhea. There's also GI issues like we've mentioned previously, IBS, Crohn's disease that can also cause it.
So if you have that short-term acute diarrhea, it can be treated with over-the-counter meds such as Imodium or Pepto-Bismol. But these aren't recommended if you have additional symptoms like a fever or abdominal pain, unexplained weight loss, black tarry stools, or persistent vomiting. These meds might treat the symptom, but they might mask the true cause. If you have any of these symptoms in addition to diarrhea for more than 2 days, you should definitely contact your doctor.
Dehydration is a concern with ongoing diarrhea. As Susan mentioned at the top of the show, when poop is moving too quickly through the colon, there's not enough time for water to be absorbed. So it's important to stay hydrated by drinking water, fruit juice, broth, sports drinks, Pedialyte, again, not sponsored, to help replace the water and electrolytes that are lost. A bland diet is best, including things like crackers, toast, white rice, potatoes, and spicy, fatty foods, caffeinated beverages, and then any high-fiber, raw fruits and vegetables are to be avoided.
If you have chronic diarrhea, the treatment for that really varies, and it's specific to whatever's causing the condition. But sometimes probiotics, friendly bacteria that we talked about before in the microbiome, are sometimes recommended. These can be found in things like yogurt and kombucha.
So my dog Luke has GI issues.
Poor
I think
Luke.
Maybe IBS, I'm not sure. But he's on prescription high-fiber dog food, and we've had several instances of gastritis where he has to be on antibiotics for a period of time. And our vet always says to make sure to follow up a series of antibiotics with these probiotic packets that she provides.
I think that's pretty common now. I think a lot of doctors who prescribe antibiotics are also encouraging people when they have finished the course of their antibiotic to consume more things like yogurt to improve their gut microbiome.
So this is sort of out of left field, but another thing I've been asked about maybe only once or twice, floating poop. I've had a student ask me after class like, hey, my poop is floating. It didn't used to, now it is. What does that mean?
Good question. Fecal matter typically is denser than water, so it usually sinks, but sometimes it can float. This could indicate malabsorption of nutrients such as fat. It could be an infection or even inflammation of the pancreas called pancreatitis. But floating on its own typically isn't too concerning unless there are other troubling symptoms like abdominal pain, fever, nausea, and vomiting. Has students ever asked you about poop color?
Yes, but not as often as some of these other questions. I assume yours have. What have you been asked?
Yeah, the same. Not too often. And again, usually in a whisper or an after-class private conversation. Students have expressed some concern about blue or black colored poop. And I have to reassure them that, you know what, that's not a big deal. It's usually a side effect of some food dyes. We're actually going to talk about food dyes in another episode, so stay tuned. If you consume blueberries or iron supplements and even Pepto-Bismol, that can turn your stool very dark and be kind of scary. But usually darkness of the stool is okay unless it also has a tar-like consistency, and that could be a sign of bleeding somewhere in the GI tract. So if it's dark and looks like tar, you should be checked out.
Green stools can also be from certain foods, such as consuming a lot of green veggies, spinach, kale, and then also certain food dyes. This shade of poop is usually not very concerning. Yellow poop is often seen from babies who are breastfed, but if you as an adult have yellow, greasy, smelly fecal matter, it might be a sign of malabsorption of nutrients like fat in your diet.
Orange stool is less common. It's typically a result of eating foods that have high levels of beta-carotene. Now, beta-carotene is the plant precursor to vitamin A, and it's found in orange foods like carrots, sweet potatoes, pumpkin, squash. It's actually quite good to eat those things, but don't go overboard. My parents had a friend who was convinced that if he drank a gallon of carrot juice every day, that he would live forever.
Did he?
He did not live forever. His skin was orange. I never asked him about his poop color, but I suspect it was orange too. Stool can also appear red in color. This could indicate a problem such as bleeding somewhere in the lower GI tract or having hemorrhoids. But it can also occur if you've eaten a lot of red foods like beets or tomato soup, or consumed red drinks like Gatorade or cranberry juice, or if you live in Texas, Big Red.
Absolutely.
That's why they tell you don't drink anything red before a colonoscopy.
White or pale colored stool could indicate a lack of bile. Bile is a substance our liver produces that's stored in the gallbladder that helps with our fat digestion. So white or pale colored stool could mean there's an issue with your gallbladder or your liver or your pancreas, and you should get that checked out. Poop is usually some shade of brown as a result of that bile that I just talked about. When we use bile during digestion, we reabsorb some of it, but not all of it. So that mixture of a little bit of bile with the fibrous matter, the bacteria, all of those things, tends to turn poop some shade of brown. It can be different colors, but if it's white, bright red, or black, and you don't think that it's from something you ate, you may want to see a health professional. So what's the bottom line when it comes to poop, Susan?
Bottom line. Well, pooping is complicated. Here's what we know, I think, based on the research. Good bowel health is having regular, whatever that is for you, bowel movements. That means between 3 per week to 3 times a day. Healthy pooping also includes being able to hold it for a short period of time after feeling the urge to go. Then once there, being able to pass a bowel movement within a minute or so of sitting down in the toilet, and being able to do so without pain or strain, and being able to completely empty your bowel in one pass so you don't have to come back shortly afterwards to try to pass some more. Poop consistency should be 3 to 5 on our Bristol scale. Check it out on our website. These should be soft formed logs that aren't too mushy and are easy to pass. Poop should be some shade of brown, but could be different colors based on your diet. And finally, many factors play a role in your poop experience. Your diet, your exercise patterns, your age, all influence how things go for you.
If you experience significant changes in bowel health, going more or less than usual, passing painful bowel movements, or having severe abdominal pain, if you see blood in your stool, or have extremely hard stools that are hard to pass, see your doctor.
If you have uncontrolled bowel movements, such as accidents in your pants or at night in bed, or waking up in the middle of the night to poop, feeling as though the colon never completely empties, or when your bowel movements or lack thereof are disrupting your day-to-day life, you should see a doctor.
Thanks for listening today. Join us for our next episode where we promise we won't discuss bodily excretions quite so much. Class dismissed.
We hope you enjoyed this episode. You can find the show notes and a list of sources on our website, yournutritionprofs.com.
Your homework is to follow us at Your Nutrition Profs on Instagram and to listen to our next episode. You can listen on Amazon Prime, Apple Podcasts, Spotify, or anywhere podcasts are found. We'd appreciate it if you'd like us, write a review, subscribe, and invite your family and friends to join us too.
If you have a nutrition or health question you'd like answered, let us know. We may do a show about it. Send an email to yournutritionprofs@gmail.com or click on the Contact Us page on our website.
Thanks to Brian Pittman for creating our artwork. You can find him on Instagram at BrianPittman77. See you next time.